Now we can see one major health issue which is called COPD, chronic obstructive pulmonary disease. The COPD is the one of the major health problems in the world, especially in chemical areas and previous genetical problems point of view. Some more people, nearly in world population, more than 10% of people suffering with COPD. So now we can go the introduction. It is a chronic inflammation of lungs that results in obstructed airflow from the lungs. Without proper oxygen, it becomes hard for system to sustain, and lungs work with the deep association with heart. In Indian medicine, explain dosa as a kapha and vata related. The air travels from the trachea into the lungs to bronchi. Inside the lungs, the bronchi divide into many small tubes that ends in a cluster of alveoli, which is called a tiny air sacs. Alveoli have thin walls full of capillaries. In this condition, our lungs will loses elasticity of the air sacs and bronchial tubes. So this is the introduction of the COPD. Now we can see the symptom of COPD. The symptom, the first one is the cough. The next, excessive production of the mucus, fatigue, breathlessness, lack of energy, tightness in the chest, wheezing respiration, frequent respiratory infections, shortness of the breath, blue tint of nails and lips. This is called lack of the oxygen. Rapid heartbeat, lack of mental awareness. This is the symptoms of the COPD. The next one is the complications. Now we can see the complications. The complication of the COPD: lung cancer, heart problems, hypertension, pneumonia, weight loss, malnutrition, swelling of lower limbs, depression. The depression and swelling lower limbs point of view, already both of these concepts point of view, our previous videos also there, then you can see that. So these are the complications of the COPD. The next one, causes. The causes point of view, the first one is the emphysema. It destroys the elastic fibers and fragile walls. The next one is the chronic bronchitis. In genetical problems, COPD is also one of the cause for the genetic problem. The next one is the age. More than 40 years old people mostly facing the COPD, and mostly in tobacco smoking and asthmatic condition, exposure to dust, chemicals and burning fuel, etc. These are the major causes of the arising the COPD. Now you can see the diagnostic test, PFT test, which is nothing but pulmonary function test. Next, CCT chest, CT scan of the chest. Next, oxygen in the blood test, X-ray chest, spirometry, which is the diagnosis of the how lungs are working. This is the one kind of the test. Is the lungs how will that working? This is knowing by the spirometry. Next, HP levels, different blood counts. Next, AAT, which is called a alpha 1 test. That is also one of the major tests of the COPD. Next, 2D echo, ECG, etc. These are the tests. The main warning of the COPD, early treatment is the best prevention of the COPD. So this is every COPD patient should be remember that. Now you can see the diet and habitual life. According to body type, some of major diet is part of the COPD treatment. They especially avoiding the food point of view, oil foods, sweets, fast foods, coconut, thick soups, opposite action food. Opposite action food point of view also one video is there in our channel, then you can see that. Next, lady fingers. Next, custard apple, cooling items, tobacco smoking. These are the mainly should avoided by the COPD patients. The next one is the treatment. In treatment point of view, in allopathy, some steroid medicines also there. That steroid medicine directly injected to the our throat. Like just pressing point of view, one argument is there. Then you can keep that in your mouth. Then press like that. That medicine directly go through the throat to like bronchial to lungs. So this is that is also one kind of the steroid. So permanent solutions point of view, in Indian medicine is the best for the COPD patients, because in a lot of cases we can see in my regular practice COPD. So here in Indian medicine, like Ayurveda and Siddha point of view, the Panchakarma treatment also, the main treatment is for the COPD. The COPD is Swadhana Chikitsa and Samana Chikitsa. Samana Chikitsa for only giving the medicines. Then Swadhana Chikitsa means totally clearing that complaint. So according to patient, the Swadhana means in Swadhana Chikitsa you can do by using of the Panchakarma treatment. So Panchakarma treatment also there, Marma treatment also there, and the very main useful medicines also available in Ayurveda and Siddha for COPD complaints. Immunity improve point of view also, some medicines also you can give that, and especially that COPD patient mostly lack of mental awareness is there. This is one kind of the mostly the dangerous symptom, because I saw some patients in my practice, in my personal practice, they are also fixed. Maybe we can die within 2-3 months or 2-3 years. Then how to survive my family like that? They are thinking like that. But in practically, they have some more time is there. They are facing a death. But they are previously they are thinking like that. So total family members should be give the mental strength to that particular COPD patients. That's a very important. So any problem, especially in respiratory related, you can give the best treatment in the Ayurveda and Siddha. So then you can go the best Ayurvedic and Siddha physicians at near of your area. Then you can take in proper treatment. So then your complaint it's totally clear by the from the roots. So don't worry, all COPD patients, please aware about that, about your condition, and be brave. So soonly your complaint will clear. Okay, thank you. Namaskar.